From the battlefield to the boardroom, our next guest, Sam Peterson, channeled his military experience into a mission of mental health support. Sam, welcome.
Thanks for having me. Really appreciate being on the show.
Oh, we're so glad you're here. This is just so inspiring and intriguing. Like, tell us a little bit about your journey from serving in Afghanistan to becoming a leader in mental health entrepreneurship.
Well, I don't know if I'm a leader yet, but thank you for that. Where I come into mental health is from the perspective of a patient. Not a lot of people know this, but Explosive Ordnance Disposal, the military's bomb squad was my previous career, and it has the highest suicide rate of any job in the Department of Defense. And the reason being for that is the continuous exposure to traumatic blasts, and that was something that I struggled with that I didn't realize, um, and that my entire career field struggles with. At one point, I was suicidal. I nearly took my own life on Christmas Eve 2014. And luckily enough, right before I pulled the trigger, my phone went off in my pocket, and it saved my life. And I was able to get help, more effective help than what was offered, through the traditional military medical establishment, and it completely changed my life. And but what really drove me to get into this was about 5 months after that incident. A mentor of mine uh, walked out into his backyard and shot himself in the head with his 3-year-old son in the house, and it really it floored me. I thought I was alone in the pain that I was feeling, and it turns out that even the pinnacle of our career field was going through that same thing. And it really sparked this lifelong journey of finding more effective ways to treat traumatic brain injuries, PTSD, and depression in veterans and first responders. And I'm happy to say that with the newest the newest and latest medical technology, we're able to do just that.
Wow. Just your story alone about how you almost took your own life, 10 years ago, and then your friend who did take his own life. We are hearing more and more about this rise in suicides with veterans. What is driving this and what needs to be done? Is it more programs like yours?
Yeah, there's a couple things. The first is right now our medical establishment is very much focused on addressing symptomology for these issues. You know, when we're talking about, depression, the idea that we can upregulate the amount of serotonin in the synapse to get you out of that depressed mood is, is how we is how the traditional establishment treats depression right now. And just from that lens, like we're treating symptoms instead of getting to the root cause. And I would like to see us get to the root cause of these issues a lot more in medical treatment. Like just speaking about traumatic brain injuries, for instance, at the end of the day, a traumatic brain injury at its core is a hypoxic injury. There is inflammation in the brain that is cutting off blood flow to parts of the brain, and when you cut off blood flow to the parts of brain, that your cells have to create energy in a less efficient and more waste producing way. What can we do about that? We can use things like hyperbaric oxygen therapy to downregulate inflammation, open up those pathways, and hyperoxygenate the brain. And I would like to see, our medical establishment go more towards addressing those root causes. And in many cases, the inflammatory cascade from things like post traumatic stress disorder, depression, and traumatic brain injuries is at the root of our dysfunction.
Mm. Well, you kind of touched on, your challenges, having worked with the bomb squad with the highest suicide rate. And I'm sure when you transitioned back to civilian life, that was just so difficult. What helped you to do that? And how does that now influence your work with mental health care?
Well, one of the biggest things that helped me was gaining back a sense of purpose. You know, it's very easy for us as veterans and combat veterans to lose that purpose when we leave the military. You know, our identity really does come off of us when the uniform comes off. And I think, you know, for myself, and I think I speak for a lot of veterans when I say this, is it's really important for our mental health to find that next sense of purpose. And for me, that sense of purpose comes from serving, you know, my brothers and sisters who have made these sacrifices and getting them back to a place where they can function normally in society and aren't just stuck in, you know, whether it's their depression hole or panic attacks all the time or dealing with traumatic brain injury symptoms constantly. That's where I find my purpose.
Yeah, so what are some of the treatments that you are using with veterans who are dealing with similar issues?
Well, it, thanks for asking that. What we use in our programs is a combination of ketamine infusion therapy to downregulate inflammation in the brain, uh, hyperbaric oxygen therapy to hyperoxygenate the bloodstream, increase the potential energy creation of the cells, and transcranial magnetic stimulation, which is a magnetic coil that's placed over certain parts of the head. And by creating this magnetic field under the surface of the scalp, we're able to upregulate the density of neurons in certain parts of the brain and, you know, effectively provide a dimmer switch from the symptoms that our patients are dealing with.
Wow. Okay. We definitely need to have you back because we have to delve into this all a little bit deeper. So thank you so much for coming on today, and we definitely are going to have you back to go a little bit more in depth, Sam.
Oh, happy to. I love this stuff, and it's very fascinating. And I think there's a lot of hope to be found in it as well. People need to know that we have the technology right now to heal these injuries and to get people back to the person that, you know, they were before that that insult to the brain and that injury happened.
Yes, that's the message we want to get out there. There definitely, as Sam says, is hope, and you are not alone. So thank you so much, Sam.
Yep. Thank you.